More monkeypox vaccines are coming to New York. That's the good news from Governor Hochul's briefing today, but it comes as cases are continuing to climb.
All right, Matt King joins us now with more on what we can expect to see happen in the coming weeks. Mac.
Yeah, Steve, Teresa, this outbreak that started 2.5 months ago and reached the U.S. in May has now spread to more than 60 countries, many with no previous history of local transmission of the virus.
Our state, New York State, has the highest numbers by far in the nation.
And when discussing monkeypox, as New York State Health Commissioner Dr. Mary Bassett was Wednesday morning, New York City tallying 639 of the state's 679 and the nation's 2,100 confirmed cases of the virus leaves health officials and elected leaders in the state clamoring for more doses of the monkeypox vaccine.
We do not at this time have vaccine to provide vaccination to everybody who wants or needs a vaccine.
As of Wednesday, New York had received nearly 65,000 doses of the monkeypox vaccine, which it's reserved for those with suspected exposure to the virus in the last 2 weeks.
That's enough vaccines for the first shot for about 50% of the population at risk.
White House COVID-19 response coordinator Dr. Ashish Jha admitted that was not nearly enough, but promised another 760,000 doses entering the United States from Denmark early next week, pending FDA approval, and then reaching local health departments like the one in Suffolk County, which announced a series of pop-up clinics on both Fire Island and the mainland, opening later this week.
Anyone can get monkeypox, but right now, this virus is spreading through the social networks of men who have sex with men.
Dr. Bassett called that one of the 3 unusual and concerning characteristics of this outbreak. The other 2, the virus's appearance in countries where it doesn't usually pop up, and symptoms that differ from what one might find when Googling monkeypox.
This is something that nobody wants to get.
Rarely fatal, with no deaths reported so far in the United States, monkeypox causes a painful rash that can last and remain contagious for up to a month. To confirm a case, health workers must swab an open pustule. No at-home rapid test yet exists for the virus.
We expect the number of cases to increase.
In a statement, the city's health commissioner wrote, "We appreciate the additional vaccines from the federal government and continue to push for more doses to be allocated to New York City." The city's received around 26,000 doses of the vaccine. Steve?
Very well. All right. Thanks, Mac.